Hi, I'm Brooke's mom.
Millions of women have become pregnant due to rape, incest, or sexual coercion in the United States. Many of these women do not have the resources to provide for an unplanned baby, nor are they in the state of mental well-being to appropriately care for the child and themselves. The terms rape and sexual coercion are non-consensual forms of sexual intercourse, the former through physical force or incapacitation, and the latter through verbal pressure. Incest is defined as sexual relations between two people closely related. It can be consensual or non consensual, but it is illegal in America. All three forms have the possibility of resulting in pregnancy. Too many women experience pregnancy due to rape or incest, so an abortion ban would add to a victim's trauma by either forcing them to carry the fetus to term, endure a pregnancy with a higher likelihood of complication, or undergo an illegal and unsafe abortion. Originally, abortion was non-surgical and was a process carried out through apothecary medicine, but it was modified with time and became more effective with modern technology. Abortion was first banned in the U.S. during the 1800s after the Civil War. There was an anticipated increase in the diverse population of the now freed African Americans and other races that were emigrating into the U.S. So the white men in power forced many white women to give birth to the children they carried in order to keep the white population in the majority. In 1973, the Supreme Court case Roe v. Wade ruled that the states did not have the right to ban abortion. Due to Dobbs' decision that overturned Roe v. Wade in 2022, states have the right to ban abortion. When taking a closer look at abortion bans throughout the U.S., we can see that out of the 14 states with total abortion bans, 9 lack a rape or incest exception. The remaining 5 have exceptions for cases of rape or incest, but limit these exceptions to the earlier stages of pregnancy. It can take some women a couple of months to find out that they are pregnant, and then they may miss the time limit they are given in their state to receive an abortion. Victims of rape and incest will experience immense trauma if they aren't given the right to an abortion. Denying women of this right and forcing them to carry the fetus to term magnifies the trauma they have experienced. For the rest of their pregnancy, they will be constantly reminded of the atrocious assault that they were subjected to. Their bodies will begin to change to accommodate the growing fetus that has invaded their uterus against their will. A study was done by experts on women who have become pregnant due to rape or incest, and many described symptoms associated with post-traumatic stress disorder, PTSD, during the pregnancy or birth, which included flashbacks, nightmares, a sense of being in the trauma, avoidance of trauma-related stimuli, or finding their memories muddled between their birth and sexual assault. Forcing women to relive their traumatic experiences is unethical, and the government should be doing more to support these women instead. Victims of rape or incest are likely to have a high-risk pregnancy. Victims of rape and incest have a probability of sustaining genital injuries and sexually transmitted diseases, STDs, that can have long-lasting effects and can lead to pregnancy complications. Not only would STDs affect a pregnancy, but they could also pass from the mother to the fetus during delivery. It would be cruel to force a disease on a baby that could either lead to its premature death or long-term health issues. Stress is another thing that can lead to complications in a pregnancy. And studies have shown that among victims who have experienced pregnancy from rape, 28% experienced a sexually transmitted disease, 66% were injured, and over 80% were fearful or concerned for their safety. Studies have also shown that female victims of rape and incest are more likely to be under the age of 18. Health experts claim that carrying a baby to full term carries higher pregnancy-related risks for a teenager or child than it would for an adult, and that risk increases the younger a girl is. A girl as young as 8 years old could start her menstrual cycle, but in no other way is she prepared to carry a fetus and sustain the damages that it would do to her underdeveloped body. All these factors added to a pregnancy can be life-threatening to the mother and the fetus. Banning abortion does not stop abortion from happening, it just makes them more dangerous. When a woman who's been sexually assaulted and is denied an abortion, chances are she's going to look for an alternative option. An unsafe abortion is a procedure that is carried out either by someone lacking the necessary skills or in an unsafe environment. The most common methods for an unsafe abortion are ingesting toxic fluids or inserting a sharp object into the uterus. Both methods are extremely dangerous, as some 68,000 women die of unsafe abortion annually, making it one of the leading causes of maternal mortality. Of the women who survive unsafe abortions, 5 million suffer long-term complications. When a woman becomes pregnant due to rape or incest, she'll become desperate to terminate the pregnancy. Therefore, an exception in abortion bans would help decrease the number of women who die annually due to illegal abortions. The problem that comes from arguing for an exception for rape and incest in abortion bans is that it can have a negative effect on other women who need an abortion, as well as women who have been sexually assaulted. Instead of removing the ban, an exception can be used as an inadequate replacement that leaves out many women. Some people argue that exceptions for rape and incest inserted in abortion bans remains a common way to deflect from the overall negative impact of abortion bans on pregnant people, falsely signaling that access to abortion remains, which is paradoxical to the goal of these bans. Having only an exception for rape and incest means that women who become pregnant due to different circumstances are not included. Having this exception also means that many victims will not be believed, and a substantial amount of evidence will be needed before women can obtain an abortion. While exceptions in abortion bans for rape and incest have some negative impacts on women who do not fit the requirements, it is a good starting place. An exception is necessary because it is better than not having any exception, and it makes abortion available to the women who need it the most. An exception for rape and incest is the most important, and after every state has an exception inserted into their abortion bans, then more focus can go to removing the bans entirely. Abortion should be legal in every state, or at the very least, there should be an exception for rape or incest. Forcing a woman to carry a rape or incest-related pregnancy is despicable and will only cause further trauma to the victim. When victims are given the right to choose whether they want an abortion or not, it shows them that after what they have experienced, they still have ownership over their bodies. Allowing a woman to get an abortion after she's been assaulted will help her get past the trauma easier and carry on with her life. Exceptions in abortion bans help us protect women's health and reproductive rights and give them the support they need after experiencing something traumatic.